You may have heard of Alice in Wonderland, the novel or the movie, but have you heard of Alice in Wonderland syndrome? Hello everyone, my name is ZAIDAH NURBATRISYIA binti ROZALY, student ID number 2023423676, and today we will dive further into this topic. So the first time you might have heard of Alice in Wonderland might be through one of these pieces. If you are on the younger generation, it might be through Disney movies, be it the more popular 2010 live action film or the older 1951 animated film. If you are on the older generation, it might be through the children's novel written by Louis Carroll and published in 1865. There were countless of things, countless of people that was inspired by this single piece of literature. You can go anywhere and you can see parties, arts, gardens that were inspired by the theme of Alice in Wonderland. But do you know what else got inspired by this? If your answer is Alice in Wonderland syndrome, then your answer is correct. So today we'll be looking at what Alice in Wonderland syndrome is. We will also be looking at the symptoms and also identify the causes behind this syndrome. So Alice in Wonderland syndrome, henceforth will be referred to as AIWS, is a rare disorder that causes distortion of vision and time. So in simpler terms, you may struggle to comprehend sizes, distance, and time, among other things. So it was first discovered by Carol Lippmann in 1952, and Alice in Wonderland syndrome is also known as the TODS syndrome. This syndrome is commonly reported in children compared to adults. So you may wonder who Mr. Todd is. As I said before, it's also known as Todd syndrome. So Todd refers to Mr. John Todd, Dr. John Todd, an English psychiatrist. So he was the one who named this disorder Alice in Wonderland syndrome, AIWS, in 1955. So, despite not being the first person to discover this syndrome, due to the fact that his report of 6 cases of AIWS patient is the most influential, he was given the rights to name this syndrome AIWS and had this syndrome also named after him, which is Todd's syndrome. So as of 2016, we have 169 patients diagnosed officially. And among those 169, 162 of them left their sex information. They have given permission to reveal their gender. And this data is taken from Lanska and Lanska in 2016. We can see that the population of the amount of female patient is 44.4% compared to male 55.6%. So there is lesser number in female compared to male, but it is almost balanced. You might wonder, why am I using the data from 2016 when we are currently living in 2024? So the answer is simple. Like I said before, as of 2016, for the past 60 years, we only have less than 200 patients, which means not a lot. So these are all that we have as of now. So among those 169 patients, 166 have given permission to have their age revealed, and the amount of patient aged 18 years old and younger is 132, while the amount of patient aged 19 years old and older is 34. This data is also taken from Lanska and Lanska in 2016. And as you can see, there's a considerable differences between those two age group. This might be the case because the older, it's harder to diagnose the older generation. They might already be used to the condition they are in. They might have already be able to differentiate between AIWS and the reality. There are more adapted to the society compared to the younger generation who are still struggling to control their emotion. So it is easier to diagnose children compared to the older generations, to adults 19 years old and older. So there is no concrete treatment for AIWS, and there is no concrete causes behind this symptom. However, we have some symptoms that we can see, the common symptom that AIWS patients have. We have one keyword, which is distortion. We can see the distortion, the patient can see distortion in people, objects, time, and also their hearing. So in people, they can see in themselves or in other people the changes of size, shapes. The same goes for objects. They can see changes in size and also shape. As for time, at times they can see their time moving faster, at times it can be slower, and sometimes not moving at all. They can also see or hear distortion in sounds or voices. Sometimes they can hear voices abnormally slow and at times unnaturally fast. So this is what generally what AIWS patients see. They don't see the same thing, but the essence is the same. Sometimes everything is bigger, sometimes everything is smaller. So as you can see, Alice here can see Mad Hatter being much bigger, and on the right picture, the Queen is much smaller. So this applies not only to people but also to objects as well. Sometimes they can see their surrounding growing bigger. Sometimes they can see their surrounding shrinking smaller. Sometimes you might be bigger, sometimes you might be smaller. So not only their surrounding, their perception towards themselves also might be different. So at times, some patients can even experience themselves changing in size, changing in shape. Some patients even report that they can feel themselves growing or shrinking. There was one case that mentioned that they can see their arms growing smaller, growing shorter compared to the other arms, which is interesting. Sometimes you just see things distorted. As you can see here, the queen's head is bigger. You can see faces on flowers. You can see rabbits wearing coats. So the same goes for AIWS patients. They see similar things, not totally like this, but they can see weird things too. So one case mentioned that instead of seeing a full head to toe, a person head to toe, they see the body from neck to toe, and the head is replaced with a dragon's head, which is interesting. Like you see human body but dragon's head. So just like Alice, they can experience these things too. Not only that, their time perception might be different too. Uh, Sometimes, as I said, they can feel their time moving faster. Sometimes the time is moving slower. At times, not moving at all. And one case mentioned that they hear their mother's voice. At times goes unnaturally fast. At times goes oddly slow. It's like their time is messed up, which affects the voice of the person or the sound of the surrounding. So the causes of this symptom might be due to abnormal blood flow. It can be caused by migraines or brain effects. Next is Epstein-Barr. It is a DNA virus. It can be caused by stress, weak immune system, and also hormonal change. And the next is brain pressure. It can be caused by cough medicine like suppressants and expectorants, and hallucinogenic drugs like LSD, mescaline and PCP that can cause hallucinations, uh, epilepsy, stroke, brain tumor or cancer, genetical migraine, and lack of sleep. So to conclude, AIWS, AIWS is a syndrome and not a disease. So the patients are not hallucinating, nor they have any eye-related problem, any issues with their eyes. No, it's just their brain perception towards their surrounding, towards the stimulus around them. So if you suspect yourself or the people around you of having AIWS, you can go through the magnetic resonance imaging, MRI scanner, or the electroencephalogram, the EEG, or you can take blood tests to ensure whether you do have or you do not have AIWS. So the doctors, as I said before, have not yet discovered a concrete treatment for AIWS. However, the doctors will recommend you to have proper rest, enough rest, receive treatments for your migraine symptoms or infections, take anti-seizure or antidepressants, and not to panic about your condition to avoid further issues. So, for us as a society, it is vital for us to recognize these symptoms and causes in case it happens to the people around us or us, so that we can have them medically diagnosed, so we can improve the society and the livelihood of AIWS patients by reporting these cases to the researchers or the doctors, so they have more material to experiment with to discover the best treatment plan for the patients. So here are the reference lists that I used to do this research in making this presentation. So if you have any questions or any curiosities, you can go to one of these links and you can discover more about AIWS. So, all in all, this is a fascinating syndrome. It is a bit interesting that you can see things weirdly. It might be fun, but to have this permanently and every day, each day of your life, where it leaves you wondering whether what you are seeing is a reality or not, I don't think so. So that is all from me. Thank you very much. I hope you had fun listening. Thank you.